Many Granite Staters have already made the decision to get vaccinated, but there's a lot of you who are still hesitant.
So we want to help you get answers to your COVID-19 vaccine questions. We asked Dr. Michael Calderwood, infectious disease specialist from Dartmouth-Hitchcock, to join us this evening. We're so glad to see you. Good evening to you, Dr. Calderwood.
Happy to be here.
Our first question comes in. How is the Johnson & Johnson vaccine different than the Pfizer and the Moderna vaccines?
So the Moderna and the Pfizer vaccines use a new technology where it has a piece of messenger RNA, and that basically is the code that tells your body how to produce the protein that forms that spike antibody that goes on the surface of the virus, and it can train your immune system to basically create antibodies to fight against that. And so that is kind of the mRNA technology. You're sticking in a piece of mRNA. It is short-lived. It basically is taken up into your lymph nodes. You develop immunity against it, and then that mRNA degrades and goes away. The Johnson & Johnson vaccine and some of the other vaccines are actually using a viral vector technology where they use a basically attenuated virus to deliver similar code. So it, in the end, is doing the same thing. It's helping you to develop that immunity. It is a more traditional technology for vaccines. It just is a little bit longer in terms of how you develop it. And so the great thing about the mRNA vaccines is they're very quick in terms of developing and modifying, which will be great as we move forward with this pandemic.
Danielle asks, how long after recovering from COVID should someone wait to get their vaccination?
So in general, we feel that you have some immunity from the infection, at least out to 3 months. And so there's no contraindication to getting the vaccine at any point after you've recovered. And it is recommended that even if you've had COVID, that you still get vaccinated. But in general, the feeling is that you probably have a good level of immunity out to about 90 days. And so if you wanted to wait, that would be the time period.
Here's a question that we get a lot. North asks, what kind of side effects can the COVID-19 vaccine have? And do the same side effects apply to kids 12 to 15 years old?
So a common question we get. And I want to just remind folks, it is remarkable. We have, at this point, given this vaccine to over 1.5 billion people around the world. And so, and that's the number of doses. And the, if we look at the side effects, they are what we're seeing in the trials and actually in kind of the post-market, when we begin to do these outside of trials, they're actually less than we were seeing in the trials. Most people have a sore arm like you would get with a flu vaccine. Some people have a short period of fatigue, maybe some headache, and a few people are getting fever. These tend to last at most 1 to 2 days, and longer term side effects are extremely rare. And most people who get it actually say they were expecting more side effects and are surprised they feel so well after getting the vaccine.
And doctor, does the same apply to 12 to 15-year-olds?
It does. And in fact, very similar side effects. We see slightly higher side effects with the second dose. And that's because you've primed your immune system and you're getting a boost with that second dose. I would say most of the 12 to 15-year-olds that I've spoken with who have gotten just the first dose of the Pfizer did pretty well and it didn't have many side effects. We would expect with the second dose that they may have, again, a day or two of a little bit of fatigue and these other symptoms. But we're really not seeing any difference in these younger ages.
Something to plan for this summer. Thanks so much, doctor. Stick with us. We have more questions coming your way right after a quick break.